So we've taken a really nice big diaphragmatic breath in. Now, of course, the next thing that happens is that breath out, so exhalation. And what we get is pretty much a reverse of everything that happened with the breath in. So now all the muscles that we use to lift and expand the rib cage switch off. And then the muscles that decrease the pressure in the chest, so that are responsible for deflating the chest and decreasing pressure in the thorax, which is what causes the air to be squeezed out, turn on. So we have the internal intercostals, which are the opposite of the external intercostals, which play a role in that. And then in terms of the movement of the diaphragm, so obviously before the breath in, the diaphragm descended, so bowed down. Now we get the ascension of the diaphragm. So the diaphragm now moves back up. Now, what happens here with that move up of the diaphragm is then we also get a little squeeze in of the TVA. So the TVA is that core muscle which runs around you like a belt, so wraps around you all the way like here. You may be familiar with that, or you may have heard that referenced as your TVA or your transverse abdominis if and when you've done core work, when you've been in the gym, or if you've ever done anything like Pilates or something that's focused on the core. So as the diaphragm ascends, our transverse abdominis squeezes in, which is what pushes all of our viscera kind of back in and then encourages the diaphragm to go back up, which then puts gravity pushing on the rib cage. So up here we lose the volume and then the air is squeezed out. So all of those muscles that were doing the work to expand before switch off, and the ones that pull the rib cage down turn on. So that includes our internal and our external obliques, which are those abdominal muscles that come across here. You may be familiar with those if you do any kind of twisting or rotating movements for your core in the gym. Also our rectus abdominis, which is that big abdominal muscle that comes down the front that we associate with the six-pack. And also in a forced exhalation, we may also use the quadratus lumbarum, so the QL, which is that little back muscle that sits in here, or that kind of deeper back muscle that sits here. That's typically used with something like a big cough or a big sneeze when you're having a really quick, forceful exhalation. Now what we tend to see too, if people aren't doing nice big deep belly breaths and diaphragmatically breathing throughout the day, obviously when we're working out, we touched on this in the video before, you're going to be in oxygen debt. Your body is going to require you to start pulling oxygen in, which is why we go into those shorter, shallower breaths, because your body's like, give that to me. So that's the mechanism for doing that. Useful for when we're working out, not super useful for when we're supposed to be just kind of relaxing and doing other things about our day. Because what can happen with those shallow breaths and all of the work always coming from that lift and expansion and then that depression of the rib cage and all the work coming from these muscles here and these muscles here, rather than the diaphragm and the intercostals to initiate the move, then we can get super jammed up in the front of our abdominal wall too as well. Which is why, if you're starting to connect some dots here, sometimes people can struggle to actually initiate a nice big deep diaphragmatic breath because they feel kind of jammed up in here. So if you're doing short, quick, shallow breaths and chest breaths all day, you might find this is something that you struggle with, in which case you might want to look at ways that you can start to release and open up the abdominal wall to help you encourage to get into a deep diaphragmatic breath. So just to quickly recap, when we inhale, so take that nice big deep breath in, the diaphragm goes down and your TVA relaxes to obviously create space for your organs to move forwards. And then as we exhale, that TVA squeezes back in, which encourages then the ascension of the diaphragm and then that kind of gravity pushing on the rib cage to make us breathe out. So if you have any issues with these muscles, so any of the muscles that we've talked about, either through the head, the neck, the chest, the upper back, even the abdominals and all the core, this can then obviously have a carryover to the way that you breathe. And in the reverse of that, the way that you're breathing could potentially be creating issues in those muscles for you. So your job is to kind of now have a look at the way that you're breathing and see what you can do to make sure that you're not creating any dysfunction in your body. To end this video, allow me to give you another cool little fun fact, which shows how closely related the relationship between the diaphragm and the TVA, so your transverse abdominis, actually is. Another cool little fact I learned from Matt is that embryonically, your diaphragm and your transverse abdominis are made of the same tissue, which is really cool and really wild. So that goes to show that there's a very deep relationship between the two muscles there. So if we do have any dysfunction within our deeper core muscles, we ask the question, is that also affecting the way that our diaphragm is working because of that close relationship we know that they have?